As the Inland Northwest is gearing up for more COVID-19 vaccine doses, the Washington governor announced new reopening plans today. We'll break down the latest updates from the governor as well as from Idaho.
He is suspected by police of having arranged for the young lady to be picked up in Yakima and taken to Phoenix.
Plus, we've got the latest updates after a missing 15-year-old girl from Yakima was found in Nevada, 600 miles from home.
And we're tracking valley rain and mountain snow. I'll tell you when it arrives. Your forecast is next.
Our motto this year is get her done in 21. So we're starting on that today. 2020 is officially behind us. We know that brighter days are ahead.
Breaking news, Washington State has a new COVID-19 reopening plan. It's called Healthy Washington, as announced by the governor today. Good evening and thank you for joining us for KREM News at 5 tonight. I'm Mark Hanrahan.
Welcome everyone. It's good to have you here. I'm Whitney Ward. The Healthy Washington plan will be based solely on COVID-19 data in order for regions to move forward.
So here's what we know right now. There are only 2 phases now of the reopening plan. Phase 3 and Phase 4 criteria have not yet been established. The state is now broken down into regions. We're all in Phase 1 starting on January 11th. And in order to get to Phase 2, a region has to show a 10% decrease in case numbers and hospitalizations and have less than 90% ICU occupancy.
So take a look. This is a map of the 8 different regions that have been broken down across the state. And you can see Spokane over there is part of the eastern region, along with 8 other eastern Washington counties. Now, Governor Jay Inslee says the regions do not have to apply in order to move on to the next phase. It's basically going to happen automatically, and it will be all about the numbers.
Once we do get to Phase 2, it means restaurants and gyms can reopen at 25% capacity and sports competitions can resume with limited spectators. But right now, they still can't open. The governor says the important takeaway today is that we are headed in the right direction, but we're not there yet.
No one has been left untouched by the forces of this pandemic, and many of us continue to suffer in many ways. So we are not out of the woods yet, but we do want to provide a path forward for economic recovery in our state. 99.9% of the restaurants and bars in the state of Washington, we have not had to take compliance action against. And that's really encouraging that people have made these difficult decisions to follow the law and save lives.
The governor also talked about the state's effort to vaccinate Washingtonians. He said he spoke with several hospital CEOs and was encouraged by how many vaccines have already been distributed. The governor said a delay in reporting makes it appear that the process is actually going slower than it is. Yeah,
tomorrow the Department of Health also is planning to roll out its Phase Finder tool. That's to help residents determine when they will be eligible to get that vaccine.
Spokane Mayor Nadine Woodward is responding to the new reopening plan. She writes in part, new information and a clear path forward are welcomed and appreciated and help ease the frustration and fatigue that has begun setting in. A regional approach and accountability are some of the many positives that are a part of this new plan, and we look forward to greater definition of additional steps. You can read the mayor's entire statement on our website. Just head to KREM.com.
In the meantime, several Spokane County leaders are now calling for people to join the local medical corps.
That is a volunteer group that assists with various health needs. Our Casey Decker was at that press conference today. He joins us live now. And Casey, why are they asking for volunteers right now?
Yeah, well, Mark, they're looking for people to help out with the COVID-19 response. But to be clear, they're saying this isn't because of any particular emergency right now. This is a preparatory measure. They looked about a month ago and they were anticipating a spike in cases as a result of the holidays. And then they also saw other states like California where hospitalizations are increasing so rapidly that hospitals are getting overwhelmed. They want to make sure that staff are supported and don't get overwhelmed here in Spokane. And so they're looking to add people to that medical corps. Right now there's about 50 people in it to try to boost that support staff and help those people out.
All right, Casey, we did have a couple of quick questions for you. First of all, what do we know about the tasks that these volunteers would even be performing?
Right, so to be clear, they wouldn't actually be treating COVID patients, but they would be focused on treating other patients, helping out in ways like transporting people to facilities. Nurses and doctors could help people who don't have COVID to kind of take some of the load away from the doctors who are treating COVID patients. And they could also be assisting with things like day-to-day activities in post-treatment recovery, and things like mental health are also going to be on the list of tasks that these folks could be helping out with.
All right, Casey, thank you very much. We'll continue tracking that for you. In the meantime, some health officials want to stretch out the vaccine dose supply. Some are suggesting half doses or a delay in administering that second shot in order to stretch our limited supplies.
But Washington State says it's sticking to its original plan. They'll continue with recommending 2 full doses of the vaccine.
Now, the FDA is meeting this week to discuss giving half doses of Moderna's vaccine. That would be for people ages 18 to 55. Our sister station in Seattle asked if that could, though, bring some risks.
Doesn't this make the overall vaccine less effective?
Yes, so there are some risks with not receiving the second dose. One of the risks is that the vaccine effect might not be as durable.
They also asked the Washington Secretary of Health about that 1-dose idea.
It's too early to change or modify that. Maybe that is something that would happen down the road. And if it looks like that helps us, absolutely, we would go that route. But right now, I don't believe it will. And so we're going to continue to go with the 2-dose on both the Pfizer and the Moderna vaccine.
Looking to Idaho now, health officials today spoke about the next steps of the COVID-19 vaccination process.
They also gave an update on just how many doses the state has received and administered so far. We know Idaho has received about 83,475 doses of the COVID-19 vaccine. Of those received, 20,800 have been administered to that first group. That's been happening here over the last 3 weeks. Moving forward, health officials say they expect to receive 20,000 doses every week consistently. They also say they're expecting doses to become available for that second shot soon.
So with every 20,000 doses that are coming, we have another 20,000 doses that are being held for the second round of doses. And those will be shipped approximately 3 to 4 weeks later, depending upon the vaccine that it's for.
Officials also said that residents can expect to get the vaccine where they would get any other vaccine, like a pharmacy or a primary care provider. Health experts also stress the importance of continuing to wash your hands, wear a mask, and practice social distancing. Tomorrow, the Panhandle Health District will host a vaccination clinic for frontline healthcare workers. The clinics are part of Idaho's 1A timeframe. The clinics are in Hayden, Sandpoint, and Kellogg. This round of vaccinations will include healthcare workers with direct contact with COVID-19 patients. It also includes dentists and dental hygienists. If your dental office has not heard from the Panhandle Health District, you can send an email to that link right there. Well, it's on our website, head to krem.com.
Providence Health is now offering COVID-19 testing for people who do not have COVID symptoms. Testing results would be available in about 2 days. Most of this testing is actually being done in-house now. Providence is providing the testing just to give the option for people who might be asymptomatic. That's just to keep people from spreading the virus without knowing it. So the drive-through testing is happening at the Providence Medical Park in Spokane Valley. It will operate Monday through Friday from 9 a.m. to 3 p.m. and no appointment is necessary.
In the meantime, do you have a vaccine question you'd like the KREM 2 vaccine team to look into? Text it to us at 509-448-2000, and we will work hard to bring you the facts. In the meantime, for the latest COVID-19 vaccine updates, just text the word vaccine to that very same number.
All right, let's switch gears now and get to Tom Sherry in weather. You know, we've had a very mild start to the year here in the inland Northwest. Most of the snow has pretty much melted away, unless, of course, you're up in the mountains and they just keep bringing it in, right, Tom?
Boy, they do just keep bringing it in. It's snowing pretty hard right now up at Sherman Pass, and I expect to see some snow falling at Lookout Pass as the precipitation moves to the east of us, but that will happen later on tonight and into tomorrow. Right now, as you can see, we're at 39 degrees. Wind is out of the south-southeast at 9 miles per hour. So there's that snow I talked about where you see the white, that's snow. And that's in north central Washington and portions of northeastern Washington. Mostly rain, though, along I-90 in between the Moses Lake and Ritzville area. And again, that's all headed our way. We think we'll see mostly rain here in the Spokane area late tonight and continuing through the overnight hours. We'll look for an overnight low of about 34 degrees. If it does get cooler than that, or some of the higher elevations of Spokane, like here on the South Hill, possibly up around the 9 Mile Falls, Tum Tum area, you could get a little wet snow tomorrow morning before it changes to rain. And I do think it will change to rain as we look for a high on tomorrow of 41 degrees. And for the weekend, I've got mostly dry weather, but mostly cloudy. We'll look for highs in the upper 30s, overnight lows in the upper 20s. I'll check the rest of your forecast coming up in a few minutes.
Sounds good, Tom. Thank you very much. New at 5 tonight, Representative Kathy McMorris Rogers just announced that she does plan to contest the Electoral College results when the joint session of Congress meets tomorrow. Her staff released a statement. She claims this week's vote isn't about overturning an election. In part, the statement reads, it's about examining allegations of potential fraud, certifying that states are protecting election integrity and ensuring people's voices are heard, unquote. I asked the Congresswoman's spokesperson what specific allegations she is concerned with and have not yet heard back. Meantime, Republican Congressman Dan Newhouse, also from Washington, announced he will not contest the Electoral College results. A joint statement issued by more than a dozen House Republican states, Congress only has a narrow role in the presidential election process. Its job is to count the electors submitted by the states, not to determine which electors the states should have sent.